Hi, everyone. My name is Patrick Horne. I'm a nurse practitioner at the University of Florida, UF Health, and welcome to today's podcast. Today, we're going to be talking about addressing health disparities in equality considerations in our patients with MASH or MASLD. So I think one of the biggest socioeconomic factors associated with this patient population is really around finances, right? Finances as well as location. So, we talk a lot about the diagnosis of MASH, the risk factors associated with MASH, which can be a lot of things. We know it's multifactorial, right? There's genetics, but there's also environmental, there's diet, there's lifestyle, medical comorbidities, et cetera. And so when you're dealing with a patient population that may be more rural or just doesn't have the same access to quality healthcare as others do, that can play a big role in this. This is also particularly a patient population who may not have access to quality food. They may not have access to different exercise type programs or regimens, or maybe limited due to other medical comorbidities. So these are all factors that we need to take into consideration when we're looking for not only the prevalence and making the diagnosis, but also talking about outcomes with these patients. So I think our role as APPs is to be the cheerleaders and to really look at the patient individually, look at their individual situation and try to find solutions to how they can make, modifications, whether it's lifestyle modifications or whether it's even financial potential modifications to help. So we have to take into account that patients with lower socioeconomic circumstances, again, may have less access to quality food. They're living paycheck to paycheck. They might have other members of their family they're supporting, whether it's children or it could be even siblings or it could be aging parents, et cetera. So we have to take that into account and try to help them identify ways to access better quality foods, avoiding things that are processed, things that are in a can, things that maybe are microwavable, or even fast food. Oftentimes, the unhealthier foods, fast foods, et cetera, are less expensive than fresh foods, than healthy foods. So we have to try to identify ways that they can access better quality food in their current situation. I think we also need to help them identify ways to increase their activity level. Not everybody can afford to go to a gym or has access to a gym. So identifying ways that they can modify their lifestyle and their exercise in particular is also a big factor. So that could be simple things like walking. Walking doesn't cost anything. Most people at least live somewhere where they can walk. They can walk down a street. They can walk down the road to their house, whatever the case may be. They can even walk around their house. Here in Florida, of course, temperature, especially in the summertime, is always a challenge as well. And so we talk about, walking in an indoor mall if you have access to that, or again, walking inside your house. If you have access to a pool, whether it's a community pool or something like that, things like water aerobics or just, swimming are also beneficial things that you can talk about. In terms of identifying this patient population and then assessing what is their risk of fibrosis, access to NITs, for example, that's also a challenge. Again, if you're dealing with a more rural community, there is a challenge. They may not have access to things like FibroScan or MR elastography. They may not have access to a major medical center that has these tools, or they may not have the financial funds to afford that. So I think starting with the simple NITs, things like the FIB-4, even possibly the APRI are a good starting point. And then if those are abnormal, maybe then trying to figure out taking a step further, access to things like elastography, et cetera, possibly even liver biopsy. Sometimes a liver biopsy may actually be more affordable and easier accessed depending on a patient's location, depending on their insurance than say elastography might. So again, assessing the patient as a whole and individualizing the management and care based on the patient's comorbidities, based on the patient's socioeconomic status, based on the patient's geographical location and access to healthcare. I think I think I touched on this, but I think we need to be culturally sensitive to these populations and realize that not everybody has the same access that others do. And so again, it's that individualized approach of looking at what is the patient's financial situation, what is the patient's geographical location and access to programs, what can we do within their setting to maximize their ability to eat healthier, eat better foods, as well as increase their activity level. And if you have any further questions, feel free to reach out. But in the meantime, thanks for joining, and I'll see you next time.